Welcome to today's presentation. Now today's presentation is part 3 of nursing practice questions and answers about reproductive system. Now let's start with the first question. A couple comes to the family planning clinic and asks about sterilization procedures. Which question by the nurse will determine whether this method of family planning will be most appropriate. So these are the options. Option A, have you ever had surgery? Option B, do you plan to have any other children? Option C, do either of you have diabetes mellitus? Option D, do either of you have problems with the high blood pressure? Now for this question, the correct answer is option B. Do you plan to have any other children? Now let's move to the rationale. Sterilization is a method of contraception for couples who have completed their families. It should be considered a permanent end to fertility because reversal surgery is not always successful. So that is why the nurse will ask the couple about their plans for having children in the future. Finally, options A, C, and D are unrelated to this procedure. Now let's move to the second question. Question 2. The nurse will plan to make which statement to a pregnant client found to have a gynecoid pelvis? So these are the options. Option A, your type of pelvis has a narrow pubic arc. Option B, your type of pelvis is the most favorable for labor and birth. Option C, your type of pelvis is a wide pelvis, but it has a short diameter. Option D, you will need a cesarean section because this type of pelvis is not favorable for vaginal delivery. So the correct answer for this question is option B. Your type of pelvis is the most favorable for labor and birth. Now let's move to the rationale. A gynecoid pelvis is a normal pelvis and it is the most favorable for successful labor and birth. An android pelvis will be unfavorable for labor because of the narrow pelvic planes. An andropoid pelvis has an outlet that is adequate with a normal or moderately narrow pubic arc. Finally, a platypeloid pelvis has a wide transverse diameter, but the anterior-posterior diameter is short, making the outlet inadequate. Question 3. Which purposes of placental functioning would the nurse plan to include in a prenatal class? Select all that apply. So these are the options. Option A, it cushions and protects the baby. Option B, it maintains the temperature of the baby. Option C, it is the way the baby gets food and oxygen. Option D, it prevents all antibodies and viruses from passing to the baby. Option E, it provides an exchange of nutrients and waste products between the birthing parent and developing fetus. So for this question, the correct answer is option C. It is the way the baby gets food and oxygen. And option D, it prevents all antibodies and viruses from passing to the baby. Now let's move to the rationale. The placenta provides an exchange of oxygen nutrients, and waste products between the birthing parent and the fetus. The amniotic fluid surrounds, cushions, and protects the fetus and maintains the body temperature of the fetus. In my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX-RN examination 9th edition.